Hi everybody, welcome back for another edition. This is Jennifer from One Physical Therapy and Ashley from The Malleable Mom. And today we're going to be talking about posture, right? Everybody talks about posture, how important it is, and your physical therapist keeps bugging you, and your doctor, and your neighbor, and everybody you know. Why is that important? Well, we're going to talk about that today. What we want to talk about first is standing posture. As you can see with the way Ashley is currently demonstrating, she knows better, but this is not good standing posture. We have a couple things that are going on. Number one, she's standing not using her core muscles. She's using her joints to hold herself up. By sticking her hip out, she's actually using the hip to support herself. What we want to do is we want to get her to engage her own muscles, standing up nice and tall, pulling in the tummy, and when she does that, immediately it's going to make her taller, 10 years younger at least, and it also helps to take the pressure off of her back. When she stands up using her muscles, she's not going to be relying on her joints, which over time break down and can cause arthritis. So by standing up tall, engaging the abdominal muscles, taking the head and bringing the ears back over the shoulders. And the way we demonstrate that, normal head position for all of us is forward head. And that's where the chin juts out forward, and that puts a ton of pressure onto the neck and onto the nerves exiting from the spine. So to correct that, all you have to do is just push your chin back.
I love what they taught me here, which is to take your fist. My children do this all the time. You take your fist, and if you can touch the top and the bottom, to the bottom of your chin and your collarbone, then your chin is in the perfect place.
Right. And this gets, hard for a lot of people. They feel like, well, should I stick out my chest? Should I throw my shoulders back? All that's not important. If you just did what Ashley just described, that fixes it every time. All right, so that's head position. And then the other thing that a lot of people don't realize is that they're locking their knee joints. So sometimes we throw our knees back and we lock them into place. What we want to do is actually soften the knees, so just unlocking them slightly, and that again helps to activate your thigh muscles, which helps to take the pressure off your spine. Okay, thanks Ashley.
Thanks. Hey Jen, can you help me sit down?
Yes, so the next thing we want to talk about is sitting posture. So Ashley's going to demonstrate terrible sitting posture. And with this position, you can see all the things that are wrong with her posture. You can see her rounded back, you can see her legs are crossed, and you can see that her head is forward. Over time, all these things put a lot of pressure on the spine. They do this by rounding out the back, and also by cutting off the circulation of the legs because the legs are crossed, and then at the neck, putting all that extra pressure on the neck and the muscles and the nerves exiting from the spine. So to fix Ashley's posture, what we're going to have her do is to uncross her legs, to scoot her rear end all the way back in the chair. And that's the part that a lot of people always kind of forget. They try to sit up straight and maybe they'll put a lumbar support behind them, but they don't remember to put their rear end back in the chair. I always say ABC, and you guys can figure the rest of that out. Back in chair. So the next thing we want to do is give Ashley some lumbar support, and that's going to go into the small of her back, not so far that it's at her rear end. Your rear end always creates a natural shelf for the roll, so you only push it down until you can feel it touching your rear end. And then once it's in place, you physically want to lean back against it. Again, we have a lot of patients that kind of perch on the end of the chair, and that also puts a ton of pressure on the back and is not good for you. So you want to use the roll and lean back against it to put yourself in the proper position.
It feels really awkward at first, but you will get used to it. but you'll get used to it, and it makes your stomach stronger.
And those curves that are in your spine, they're designed to protect your spine. So we have 3 curves in the low back. The lordosis is the inward curve, kyphosis is the outward curve, and lordosis, again at the neck, is the inward curve. So there's 3, an inward curve, an outward curve, and an inward curve again. And why we want to keep those is basically to take the pressure off of the back.
What if I'm wearing a really short skirt and I really love crossing my legs?
Yeah. So instead of crossing your knees, you can cross your ankles. Right? So that solves the problem, and it also doesn't allow that load or twisting on your spine. The other thing that some people can do that have what I call short leg syndrome is to take a phone book or a small step stool and put it underneath of their feet. And that way, they're nice and unloaded in a relaxed position. the head will naturally fall back into alignment if you're sitting in this way. Thanks everybody. Stay tuned next time for our next message.